Diabetes is a global health challenge impacting millions worldwide. It knows no boundaries, affecting people from all walks of life, regardless of age, gender, or ethnicity. The prevalence of diabetes is rising, making it more crucial than ever to address this issue with a comprehensive and inclusive approach. Effective management requires a culturally sensitive approach, especially in diverse settings. Healthcare providers must be aware of the cultural factors that influence patients' health behaviors and attitudes towards diabetes management. This includes understanding dietary preferences, traditional practices, and social norms that may impact treatment adherence. This module explores culturally sensitive diabetes care techniques for healthcare students. By integrating cultural competence into their training, future healthcare professionals can better serve their diverse patient populations. They will learn to recognize and respect cultural differences and to tailor their care plans accordingly. We will delve into communication strategies, community-based programs, and emergency preparedness. Effective communication is key to building trust and rapport with patients from different cultural backgrounds. Community-based programs can provide support and resources that are culturally relevant and accessible. Emergency preparedness ensures that all patients receive timely and appropriate care, regardless of their cultural background. Understanding cultural perspectives is essential for providing optimal care. By acknowledging and respecting cultural differences, healthcare providers can create a more inclusive and supportive environment for their patients. This not only improves patient satisfaction, but also enhances treatment outcomes. This module will equip future healthcare professionals with the knowledge and skills to provide patient-centered care. They will learn to engage with patients in a culturally sensitive manner, to ask the right questions and to listen actively. This training will prepare them to address the unique needs of each patient, fostering a more personalized and effective approach to diabetes care. By understanding cultural nuances, we can better address the needs of all individuals. This means recognizing the barriers that may prevent patients from accessing care and finding ways to overcome them. It also means being open to learning from patients and their communities, and to continuously improving our practices. Join us as we explore the importance of cultural sensitivity in diabetes care. Together, we can make a difference in the lives of millions of people living with diabetes, by providing care that is not only effective, but also compassionate and respectful of their cultural identities. Effective communication is paramount in healthcare, especially when working with diverse populations. Cultural differences can influence communication styles, health beliefs, and attitudes towards healthcare. Healthcare providers must be mindful of these differences to establish trust and rapport with patients.
Active listening is crucial for understanding patients' perspectives and concerns. Using clear and simple language, avoiding medical jargon, can bridge communication gaps. Nonverbal communication, such as maintaining eye contact and respecting personal space, also plays a vital role in building trust.
Cultural beliefs and practices significantly influence health behaviors and perceptions of illness. Diabetes is often surrounded by myths and misconceptions that can hinder effective management. Healthcare providers must address these myths sensitively and provide evidence-based information.
Openly discussing cultural beliefs about diabetes is essential. Patients may hold traditional views about the causes and treatments of diabetes that differ from modern medicine. By acknowledging and respecting these beliefs, healthcare providers can work collaboratively with patients to find culturally acceptable solutions.
Community-based approaches are essential for addressing the growing burden of diabetes.
Engaging communities in diabetes prevention and management empowers individuals to take ownership of their health. Community programs can provide culturally tailored education, support, and resources. Collaborating with community leaders, faith-based organizations, and local health workers is crucial for program success. Understanding the community's needs and priorities ensures that programs are culturally relevant and sustainable.
Section 5. Empowering communities, the role of local leaders and health workers. In this section, we delve into the crucial roles that local leaders and health workers play in fostering community health and well-being.
Local leaders and health workers play a pivotal role in community-based diabetes care. They are often the first point of contact for individuals seeking health information and support. Their presence in the community ensures that health messages are delivered in a culturally sensitive and accessible manner. Their knowledge of the local culture, language, and customs makes them trusted messengers within their communities. This deep understanding allows them to tailor health education to the specific needs and preferences of the community, making the information more relatable and actionable. And customs makes them trusted messengers within their communities. They build strong relationships with community members, which fosters trust and encourages individuals to seek their guidance and support. This trust is essential for effective health communication and intervention.
They can effectively disseminate information, promote healthy behaviors, and provide support. By organizing workshops, health talks, and community meetings, they create platforms for sharing knowledge and addressing health concerns. These activities empower community members to take charge of their health.
Training local health workers to provide basic diabetes education and support can significantly expand the reach of healthcare services. These training programs equip them with the necessary skills and knowledge to educate others about diabetes management, prevention, and healthy lifestyle choices. They can conduct home visits, organize community events, and provide ongoing support to individuals living with diabetes and their families. Home visits allow health workers to offer personalized care and monitor the progress of patients in a familiar environment, and provide ongoing support to individuals living with diabetes and their families. Community events, such as health fairs and screenings, raise awareness and encourage community-wide participation in health initiatives. This comprehensive approach ensures that no one is left behind in the fight against diabetes.
Section 6. Success Stories, Community-Based Diabetes Programs in Africa. Africa faces significant challenges in addressing the growing burden of diabetes. However, numerous community-based programs have demonstrated success in improving diabetes outcomes.
These programs often involve community health workers, peer support groups, and culturally adapted education materials.
For example, in rural Kenya, a community-based program trained local health workers to provide diabetes education and support. The program resulted in significant improvements in diabetes knowledge, self-care behaviors, and blood sugar control among participants.
Section 7. Recognizing diabetic emergencies, a critical skill for healthcare providers. In this section, we will delve into the importance of recognizing and managing diabetic emergencies, which is an essential skill for all healthcare providers. Diabetic emergencies such as hypoglycemia, low blood sugar, and hyperglycemia, high blood sugar, can be life-threatening if not recognized and treated promptly. These conditions require immediate attention and swift action to prevent severe health consequences.
Healthcare providers must be able to identify the signs and symptoms of these emergencies and initiate appropriate interventions. This includes understanding the patient's medical history, recognizing the early warning signs, and knowing the correct procedures to follow. Hypoglycemia can cause symptoms such as confusion, dizziness, and seizures. These symptoms can escalate quickly, making it crucial for healthcare providers to act fast. Administering glucose or other fast-acting carbohydrates can often stabilize the patient. Hyperglycemia, on the other hand, can lead to excessive thirst, frequent urination, and even coma. This condition often requires insulin administration and careful monitoring of blood sugar levels to bring the patient back to a safe range. Early recognition and treatment are crucial for preventing serious complications. By staying vigilant and prepared, healthcare providers can make a significant difference in the outcomes for patients experiencing diabetic emergencies. Continuous education and training in this area are vital for maintaining high standards of patient care.
Section 8. Preparedness is key managing emergencies in resource-limited settings. Managing diabetic emergencies in resource-limited settings presents unique challenges. Access to healthcare facilities, medications, and trained personnel may be limited. Therefore, it is essential to have contingency plans in place to ensure timely and effective care.
Training community health workers and caregivers in basic emergency response techniques, such as recognizing the signs of diabetic emergencies and administering glucagon for severe hypoglycemia, can be life-saving.
Section 9 conclusion, integrating cultural sensitivity for effective diabetes management. In conclusion, cultural sensitivity is not merely an option but a necessity for effective diabetes care. By embracing diversity, communicating effectively, dispelling myths, and empowering communities, we can improve health outcomes for all individuals living with diabetes. Remember, culturally sensitive care is patient-centered care. It acknowledges and respects individual beliefs, values, and preferences. By working together, we can create a more equitable and just healthcare system for all.